COVID-19 cases continue to surge, health experts warning against guarding mental health, and school reopening plans are a go. Good evening, everyone. I'm Tyler Simonet with your JCN News for this Friday, July 23rd. Thanks for staying with us. Total COVID-19 cases in country creeping closer to 14,000, with health officials confirming 110 new COVID infections for Thursday, July 22nd, and 67 infections on Wednesday, July 21st. For a total of 177 new additional cases of COVID-19 in country over 2 days. Total COVID cases now at 13,957. Health Minister Remwood Wells, during the Ministry of Health's press conference this afternoon, also gave an update on those 92 hospitalized cases. 82 cases are considered moderately ill, while 10 are in intensive care.
Hospitalization in this third wave have been much higher than in the second wave for the Bahamas. In fact, on the 20th of July 2021, the country experienced a peak in hospitalizations at 92. These excessive numbers have placed our public health system to the test, and our gallant and valiant healthcare workers continue to rise to meet this challenge. Currently, there are a total of 38 beds available on Grand Bahama for COVID-19 patients. At the Cancer Center of the Bahamas, there are 24 beds for COVID-19 patients with mild to moderate illness. At the isolation ward, also known as Med-Surg 3, there are 14 beds for acute COVID-19 patients. Ladies and gentlemen, on the other hand, in New Providence, the situation at Princess Margaret Hospital is much more critical.
As for those COVID cases over the past 2 days, 143 new cases were confirmed on New Providence, 12 on Grand Bahama, 10 on Eleuthera, 6 on Exuma, 4 on Abaco, and 2 on Bimini and Cat Key. Total cases in country now at 13,957. Health officials also reclassifying a case. An infection that was originally attributed to Long Island has been reclassified as an Exuma case. Active cases in the Bahamas now at 1,351. Meantime, 6 COVID-19 related deaths confirmed by health officials in country this week. A 58-year-old female of New Providence who died on July 22nd, a 65-year-old and 76-year-old, both females and both of New Providence, a 56-year-old male resident of Exuma, all deaths occurring on July 20th. A 37-year-old male of New Providence who died on July 18th, and a 55-year-old male resident of Bimini who died on July 19th. These unfortunate deaths pushed the country's death toll to 280. The Ministry of Health's latest dashboard also indicating an additional death under investigation. Total there now at 23. A total of 80 cases recovered between Wednesday and Thursday. That category now tallies at 12,238, a recovery rate of 87.68%, according to Minister Wells. 115,959 COVID tests have been completed in country since March of 2020. Minister of Health Remwood Wells officially confirming that COVID-19 variants are present in the Bahamas. This coming from the Ministry of Health's COVID-19 update press conference held this afternoon. This confirmation happens 2 days after the Pan American Health Organization stated the Alpha variant of the coronavirus have been found in country.
It is confirmed that COVID-19 variants are present in our communities. The National Reference Lab recently received results from 47 samples sent via PAHO to the Fiocruz laboratory in Rio de Janeiro, Brazil, for genetic sequencing. 34 samples collected during the period, the 13th of March to the 17th of April, were successfully sequenced. Of these 34 sequenced samples, 26% actually 26 wore the UK variant of concern.
According to Minister Wells, during this third wave of the pandemic, the National Reference Laboratory has seen an uptick in the volume of COVID-19 samples collected, and it has challenged the staff there. Now, due to the circumstances of an uptick in cases in country, tighter restrictions have been announced.
Based on the recommendation of our health professionals, the government of the Bahamas has decided to take the following measures, which shall come into effect on Monday, the 26th of July, 2021 at 5 a.m. For New Providence, Grand Bahama, North and South Eleuthera, including Harbor Island, a curfew will be implemented between the hours of 10 p.m. to 5 a.m. RT-PCR tests will be required for travel from New Providence, Grand Bahama, North and South Eleuthera, including Harbor Island. This applies to persons who are not fully vaccinated.
In regards to funerals, no funerals or cremation services are permitted indoors, and funerals or burial services are to be held at the graveside only. A maximum of 30 persons are allowed at funeral services, excluding officiants. Repasts will not be permitted at this time. Exercise groups are limited to a maximum of 10 persons. Groups congregating on the beaches and parks should be no more than 5 persons. Maximum capacities at gyms and movie theaters are now set at 33%. In regards to restaurants, dining is restricted to outdoor and takeaway services, and it is encouraged that there be no loitering of groups outside restaurants or at fish fries. These restrictions, however, do not apply to hotel properties. No spas will be opened, and for all islands of the Bahamas, private gatherings will be restricted to 5 persons, provided that the individuals are fully vaccinated. Lastly, persons who are campaigning must be fully vaccinated, and campaigning teams are restricted to 5 persons. Meantime, with the Alpha variant already detected in most of the country's samples, as confirmed by the Pan American Health Organization, JCN's news team spoke with Bahamas Nurses Union President Amanja Williams about the possibility of the Delta variant possibly being detected. She says that it's of great concern.
You being vaccinated does not say that you vaccinated and fight off that. So that's a great concern. All of these things that we have to take in consideration. And when we can't guess about the Delta, if it's here or not, we have to be sure. We've had a problem with our labs. We've had exposures into our labs were shut down. And so I'm telling people, and I'm telling the Bahamas, the red flag is up. And many of us, every week, we're going to 2 or 3 funerals. Okay? Sit down, think about it. Do I want to party? Or do I want to save lives?
The World Health Organization has classified each emerging variant as either a variant of concern or a variant of interest. The Alpha, Beta, Gamma, and Delta variants fall under variants of concern, whereas the Eta, Iota, Kappa, and Lambda fall under variants of interest. As the nation faces a surge in coronavirus cases, experts say ignoring mental health puts essential workers at further risk. With these devastating waves, psychologists warn of the mental toll this pandemic has had on our essential workers. Dr. Valerie Knowles, a 30-year-plus psychology veteran, urging essential workers to prioritize their mental health so they can deal with the shared trauma they've endured. She explains that these group of persons are often overlooked because of their position in society, and even though most have made it through the deadliest pandemic in generations, their mental health shouldn't be taken for granted. Faced with unrealistic public expectations and forced to work at any hour, day, or night can destabilize relationships and endanger their mental well-being. Despite the stigma against mental health, she urges essential workers to seek professional help if they need it, or talk to a coworker who can empathize with what they're going through. She also advises them not to ignore warning signs that they are overstressed, such as heightened irritability, trouble concentrating, fatigue, trouble sleeping, and personal negligence. Dr. Knowles further urging the public and employers to acknowledge the sacrifice these workers make and try to help them cope with their COVID-19 trauma. You're watching JCN News. Stay with us.